The agenda this week learned how technology could help protect the Great Lakes, examined the state of extracurricular activities for Ontario kids, heard why dentists are concerned about who's getting treatment, and considered the trouble with global supply chains. The agenda's week in review begins with whether inclusionary zoning could help get affordable housing built.
I want to start, I guess, with just a bit of a fact file to bring our viewers and listeners up to scratch on what IZ inclusionary zoning actually is. For example, as passed by Toronto City Council, it means that 5 to 10% of condo units built around designated protected major transit station areas, those units would need to be affordable. And the range has to do with where it is in the city. So the highest percentage being downtown, the lowest percentage Scarborough Centre. That would increase to 8 to 22% of units by the year 2030. What does affordable mean? Well, affordable in this case refers to targeting households making between $32,000 and $91,000 a year. And of course, depending on the size of the unit, it could cost $800 for a studio monthly to $1,850 a month for a 3-bedroom. And affordability must be maintained for 99 years. That's the 411 on IZ. And now we want to get some feedback on what you folks think. Laurie, we're not the first city to try this. There have been other cities to try it, but we're the first in the province of Ontario to try it if it in fact happens next year. What do you think about the effort Toronto's put forward here?
Well, first, before I answer your question, I just want to say that I've been working with the building and land development industry for the last 6 years, and we absolutely support creation of affordable housing and inclusionary zoning. To answer your question, what we don't support is the Toronto program. And the reason for that is, unlike any other city across North America, Toronto has done a program where the full cost of those inclusionary zoning units is borne by the new home buyer. There is no financial offsets or incentives for the developer to provide that unit from any of the levels of government.
So, in other words, if this were a social good that governments thought was important to achieve, they should be putting some money where their mouth is.
Absolutely. This is a societal responsibility. We as Ontarians all have a role to play in creating affordable housing.
Okay, that's Laurie's view. Garima, you want to come in here and tell us what you think about that?
Sure, absolutely. You know, I find Laurie's comments really interesting. In my view, the debate about inclusionary zoning is a debate about who belongs in the city of Toronto. And so far, you know, we like to think that Toronto is this welcoming place where people from all walks of life can live, work, and play. But what we've seen over the past several decades is that people with modest incomes are being pushed out. And so, you know, in response to what Laurie is saying, that, you know, the cost of new affordable units being spread out to other new home buyers who won't be living in these affordable units, I think is a bit of is shining a light away from the reality of how costs are being distributed and what the analysis behind inclusionary zoning has held constant in terms of which variables will change. And so, you know, developer profits aren't one of those variables that will change as a result of inclusionary zoning, and market analysis that the city has undertaken has held that. And
okay,
so this,
hold
this
their
is a
agreement.
decision point. Yeah,
Got
sure.
you there. Okay, we'll dive into some of those items that you brought up as the discussion continues. Mark, how about your take on this particular IZ effort by the City of Toronto?
We spoke at council, and we are generally supportive of the moderate way that the city is trying to approach it. Inclusionary zoning is not Viagra. It's more like insulin. You need to moderate the dose and make sure you're doing a bunch of other things. Check your blood sugar, eat right. The city has tried to create a program here where they're not really putting any skin in the game themselves. And that makes it hard to create affordable housing units at the speed and scale we need to in the city of Toronto. They have other programs like Housing Now, where they are generating more units faster because the city has skin in the game.
Mark, I think I get your metaphor, even though we are a family program, and I think maybe you could have chosen a different one, but that's another story. Anyway, moving right along here. Okay, Josh, I've purposely left you for the end because I wanted you to hear what everybody else had to say about the city's efforts. You were obviously involved as a Toronto City Councillor in the debate. How do you line up on this?
Well, the development industry has proven that they will price what the market can bear. And, many cities throughout North America have inclusionary zoning policies that have percentiles that exceed Toronto's. So, this is, if anything, a cautious start as far as what we're doing. Toronto's been asking the province for several years now to allow us the tool to use inclusionary zoning. And the reason why is because I, along with my colleagues, hear, without exaggeration, every single week from residents who cannot afford to live in the city, are being priced out, have given up on their dreams for home ownership, and struggle to even make rent. What your backgrounder didn't say earlier was that along with the condos, there's also going to be a small percentage of purpose-built rental that will also be part of our inclusionary zoning policy. But inclusionary zoning is one tool in a much bigger toolbox that we need to use to be able to address the housing crisis we're experiencing.
As we think about the region, it's home to 107 million people across the Great Lakes mega region. That's 8 states and then the provinces of Ontario and Quebec. It's a significant regional economy that represents roughly 30% of Canadian American economic activity and employment, or 52 million jobs. But at the heart of this region, as we know, are the 5 Great Lakes, 21% of the world's surface fresh water, 84% of North America's surface fresh water. In fact, it's the largest freshwater system in the world, supporting every aspect of our natural environment and our way of life. But it's a finite freshwater system. Only 1% of the waters of the Great Lakes are renewed on an annual basis by precipitation, runoff, groundwater. And as Kelly mentioned, it's under tremendous stress from rapidly changing climate to invasive species, chemical, plastic, nutrient pollution to increased urban sprawl. What's troubling is that the environmental stressors we face are growing at a rate that is outpacing our ability to understand them fast enough, limiting our ability to sustainably use this resource and to protect our environment for future generations. So, we think that the Common Strategy for Great Lakes, for the first time, sets out a binational roadmap that we think is necessary for solving these issues across the Great Lakes in order to, really develop the information systems that will improve the way people learn about and respond to environmental change, how we inform critical policy and management decisions, but also how do we accelerate science and innovation as it relates to the Great Lakes.
Well, let's find a little bit more out about this roadmap. Aaron, smart technology in this case specifically means what?
Well, it means a lot of things. There's certainly been a real increase in the technology that we have available to us. And because of cellular networks, because of satellites, we also can now make that real time. And there's been a real push to be able to put equipment out in the water, like buoys that float and have sensors on them, or, autonomous vehicles like gliders that move through the Great Lakes and the oceans for that matter. And so all of these equipment are out there collecting data continuously, which is a really important point. In the past, when you wanted to study something like a harmful algal bloom, you had to go out on a boat and collect water. And so your sampling is both temporally limited and spatially limited. Now with all these new technologies that just sit in the water and collect the data, you get these continuous data sets. But it also, as Kelly was kind of alluding to, uploads it directly. So you can look at that data at any time. And so that helps us monitor things, get continuous data. We can actually react to stuff. And so that's really where the big change has been technologically. So this vision of having a smart Great Lakes, we now have the infrastructure and the instruments to do those kinds of things.
Aaron, follow up on that if you would. Give us a real life example whereby you got some information, it was uploaded to your smartphone or your computer or whatever, you found something out that was really helpful to you, and therefore you did something. For example.
Yeah, so we actually have a large project right now that's being funded by the Union Water Supply here in Leamington. They provide all the water to Southern Essex County and the greenhouse industry in Southern Essex County, which is the largest in North America and one of the largest in the world. So when they're taking water in, I don't think people realize how complicated treating water and providing it to the public is and how important it is. If there's a sudden shift in temperatures or even pH, or turbidity, or if there's a harmful algal bloom, they need to know that as soon as they can, because they can make changes to how they're delivering the water, how they're treating the water, how much water they're holding back. So we have NSERC funding from the Canadian government that has allowed us to put buoys out there, and we work directly with the water management, and they look at the data all the time. So we have buoys out there. They can go online on their cellular phone or through a computer and keep an eye on what the water temperatures are. And we have buoys further away that sort of give them an idea if there's water coming in from the central basin that might be low in oxygen. They know it's coming, they can make changes. So there's a on the ground affecting people's lives example of how that technology can be so powerful.
Gotcha. I read Mark and Kelly's report, and I note right high up in the report is an acknowledgement that for thousands and thousands of years, Indigenous people who have lived in and around the Great Lakes have been excellent stewards of them. And Barbara, I guess that's where you come into this conversation. What role do you see as Indigenous people playing in all of the efforts that are underway here?
Well, Steve, as you said, the Anishinaabe and the Haudenosaunee confederacies and other Indigenous nations have been living in relationship with the Great Lakes since the time the lakes were formed, right? And long before colonial and political borders were drawn. So the Indigenous knowledge or traditional ecological knowledge that our communities hold is very deep and very broad and based on 10,000 years of observation and lived experience with the beings of the Great Lakes. So when you start to bring in this Indigenous ecological knowledge, you start to get a bigger picture and a deeper understanding and kind of different data than smart technology can access.
You're in Manitoba. How are extracurriculars being handled there?
We're basically fully operational in our system here. There's, of course, constraints to some activities, but we had a full outdoor-indoor complement, which I'm sure is happening in some schools in Ontario as well. But most programs, because we have staff in Manitoba like George, those people can then do the homework to do the necessary thinking on how to have adequate safety for their children. And that then permits the physical activities to occur. Most principals, maybe superintendents, often create a notion of surplus safety, which surplus safety is a terrible notion. And again, I can see George and Michelle shaking their head. Surplus safety harms children because it may stop some immediate small things from happening, but it prevents all of the benefits downstream. So adequate safety in this mindset is what we need, not surplus safety. Not safe as possible, safe as necessary.
George, I saw you nodding your head there. And, you know, there are some schools, I know for my kids' schools, they don't have any extracurricular activities. First of all, I wanted to know why you were nodding and, you know, why are these activities not being prioritized by the TDSB?
Sure. So the nodding was due to frustration, but it's also a challenge. We have to provide opportunities for our students and for children, as Dr. Kralars has indicated. You know, the research there, it goes on and on. But we have to do that in a safe and caring manner. And I believe we have done, and we have given opportunities. What we need to also focus on is letting parent guardians, letting administrators, letting senior staff know that, hey, we've abided by the Ministry of Health. We've abided by Toronto Public Health. We've abided by the sporting organizations. Here is how we're moving forward. And how we're moving forward isn't necessarily how it was. There are some great takeaways that we can take from the past 19 months. And we've learned from that. But we've got to let parents and guardians know that in order for their children to reach their academic potential, they need to be active. Mm-hmm. Every parent wants their child to be safe, to be healthy. But in order to do so, they need to have that physical literacy. They need to have that those physical opportunities to be active both during the day at school and afterwards.
You use the word frustration because when the school year started, the province said that extracurricular activities could return, but then Toronto Public Health said not so fast. And then around, I think, September 20th, they said that it was fine. Is that the frustration that you're talking about?
Absolutely. And then this frustration stems from the Ministry of Education will put out quite a bit of information, but we'll say, well, you know, you have final decisions reside with your local public health agencies, and working with our local public health agencies like TPH, incredible staff. But we also have 600 schools, and to implement things, we can't have decisions made the day before school starts. We can't have decisions made on September 20th and expect a turnaround of September 21st. So being aligned has been one of the difficulties. Having schools like the independent schools in the city of Toronto who do not have to abide by the local public health and have to abide by the provincial, then it has parent guardians saying, how come this school is allowed to offer things, but the Toronto District School Board is not? And explaining that to the parent guardians of our 250,000 students is a little bit of a tough task.
Well, would you say then that the Toronto Public Health has surplus safety?
I think they are the specialists in their field. We're the specialists in education, and I think there needs to be further discussions together.
Michelle, I saw you nodding as well.
Yeah, I echo both. And I think another part of the puzzle that sometimes gets missed is that we have unions as well. So you have unions, teachers' unions that come into play. So we've got boards of education, we've got the Ministry of Education, we've got our public health units, and then we have our unions. And at times, and still happening, those four people are not speaking to one another. So this leads to where George and I sit. We are the communicators to our communities, to our athletic directors, to our coaches. And so we are taking all of this information in, ensuring that we have safe environments for not only our students, but our coaches and our officials as well. So we are trying to mitigate all of those risks while taking into account all of the different people that come to the table that don't seem to be talking to one another and aren't aligned with one another. So I felt like it has been a balancing act from the beginning. And I'm very, very thankful for the other Ontario athletic coordinators that we are on, a group together where we are trying to navigate and stay ahead of the curve to be able to communicate the most accurate information that we have at this time.
Dr. Khalid, you presumably had to incur additional costs when the pandemic hit. Can you explain to us how that pandemic affected your practice?
In so many ways, to be honest. Number one, if you want to talk about additional costs, yes, we've sealed our operatories, our rooms, air filters, increased costs in PPE. So the average dental practice may have incurred costs of $20,000 to $50,000, let's say, in the initial capital improvement and then running costs. So our costs have increased, and Dr. Heidegger's right. The Ontario Dental Association does a good analysis. By the way, we actually submit anonymously, I suppose, our actual financial statements to the Ontario Dental Association. So they're not making up these numbers. They actually look at our actual financials. They look at our profit and so on. And so their analysis is quite rigorous. I must say there's a couple of things that I just want the listeners to take note of. Number one, dentists do have a responsibility to the public, and we take this responsibility very seriously. Someone told me the other day, he said to me, why don't you guys go on strike? Just like, in a sense, the optometrists are trying, I won't say they're on strike, but they're limiting their access to care, perhaps rightly. We can't. During the 3-month period when last year, or those 3 months, April, May, June, when we were somewhat closed, my office was one of the few offices open. We saw significant dental problems. I mean, people who couldn't eat, people who couldn't sleep. We diagnosed 2 oral cancers, abscesses. So we take our job very seriously. Dentists do have a responsibility to the public, and they are well aware of that. But we just feel that it may be better for the public in a couple different ways, in many ways, if their remuneration was increased finally after decades. Someone told me that the Ministry of Health will spend $5 to $10 million on treating dental emergencies in hospital emergency rooms. And I thought, that's interesting. That's a big number. If they realized that, you know, patients who aren't being seen at their private dentist go to the dental emergency, go to hospital emergency rooms where they receive some care. If that funding was removed from the ministry of budget to the hospitals and added into this program, it would probably get a much bigger return, for example.
Right. Well, first of all, we appreciate your conscientiousness staying open during that time, and I'm sure many of your patients were extremely grateful. I do want to know how did you assume a $50,000 unanticipated cost to improve your working circumstances as it related to the pandemic? That sounds like a big nut to have to crack.
In my particular office, it was $25,000. There was government grant assistance, as you may recall, for small businesses.
And you were eligible for that?
Yes, most of it's loan. I believe it's paid back over the next couple of years. First of all, the cost, as the others have noted, of PPE, a box of gloves, for example, used to cost us $25 for one of those boxes. It hit a cost of $72 during the high point of the pandemic, and we needed more of them, not less of them. Prices have come down, though, with the world kind of improving. But there is added cost. There is added cost, and again, dentists, as all the listeners know, do have above average income, generally speaking. So no one's really complaining from that point of view. We just feel that 50% of the fee is cutting it pretty tight. And as Dr. Quinones said, if it hits 70, 75%, I think more and more dentists will accept it. By the way, as Dr. Heidegger said, maybe 50 to 70% of dentists do accept public monies for treating patients, but a far fewer number of dental specialists will. It's probably closer to 5 to 10% of specialists will accept these programs. So that also limits care.
So if I understand you, dentists don't mind taking a haircut on the fees, they just don't want to take a huge haircut on the fees.
Yes, and like my hair here, yes,
Gotcha.
Exactly.
Okay, sorry, that was not meant as an insult to you, I assure you. Dr. Heidegger, I want you, if you would, to comment, because we asked the Ministry of Children, Community and Social Services to participate in this program. We hope that they would give us somebody who could come on and discuss this issue with you, and they declined the invitation, which is their right to do. The spokesperson for the ministry also said the ministry doesn't track which dentists provide which services and to whom. And they did send this statement over. They said, we continue to roll out a more responsive, efficient, and person-centered social assistance system that will help individuals and the economy recover from the COVID-19 pandemic. What do you make of that?
I'm not really sure what to make of that.
Does it sound like bureaucraty's gobbledygook to you?
Yeah, I think so. I'm not sure if they were they were wanting to prove that they are looking after the situation without knowing too much what's going on about it.
Which raises the question, Besma, of whether we are too reliant on China. What say you?
Absolutely too reliant, but so is the entire world. That's the challenge. The challenge is everybody is too reliant on China. And again, you can, I think, replace China with a different country at a different time. I mean, interdependency, just by virtue of the concept, is vulnerability. We are vulnerable by being interdependent. And again, things work like clockwork when there aren't pandemics and when there aren't geopolitical challenges and then when there aren't climate change. But all of those things are heightened at the moment. And so we haven't even got into the geopolitical challenges that exist with China today. And I would also add that Chinese government is very different than it was previously. We have a leader today, President Xi, that's very nationalistic. He's also talking about dual circulation theory, which is being more independent domestically, so for them to be less interdependent on us. Can you imagine that? And so I think this is all just to contribute to the argument that we do need to think about these things more critically. I think we just sort of had too much faith in globalization and interdependence to our own fault. And now it's time to sort of rethink it. Add to the fact that, again, climate change is here to stay, unfortunately. So we need to rethink these supply chains no matter what.
Dan, can we break our dependence on China?
So first of all, I think that the statistic that you have shown, because I actually want to defend globalization to a degree, if you just think about what it did for most of humanity. But the reality is we didn't have globalization. We had a very skewed globalization where the whole world became more and more dependent on one really tiny region of the world, if you think globally. We do not have global production or global supply chain. We have a Chinese dominant supply chains, and that's the problem. And so we need to do something about it. Even if China was the most friendliest, democratic, human-loving nation the world have ever seen, this resiliency in time of pandemic, in time of climate crisis, is just not sustainable. We have to figure out how we create much more resilient, global and regional supply chain. And Canada have to start to have this debate because other countries are already doing it.
It sounds, though, Parent Beatty, that if we try to pursue those other options, they're all going to be more expensive, or at least hard to do. So what's the incentive for doing them?
Supply. It's that you don't run out of the materials that you need, that you're able, particularly times of crisis, to be able to protect your security and to provide the services that are essential. It's important, Steve, for us to understand here when we use the term global supply chain, that the issue, the problem is global. It's not susceptible to being resolved here entirely by Canada acting on its own, and countries around the world are wrestling with the same issue, and businesses around the world are wrestling with this issue. So we need to work in conjunction with others to do this. We also need to look at what elements of the supply chain issues are susceptible to being resolved here in Canada. For example, the issue of truck drivers. Even if you can bring something from China, land it at the Port of Vancouver, even if the Port of Vancouver is open and not cut off from the rest of the country, you still need truck drivers to be able to get the product to where it's going. That's an issue that others aren't going to resolve for us. We have to resolve that here in Canada. So we need a very focused effort in terms of what we can do here, and we need to collaborate with other partners to resolve the international aspects. And at the end of the day, there's no question that there are going to be elements of this that are going to be more expensive. But if the alternative is that everything shuts down because we can't get our hands on the supplies we need, that would be the most expensive of all.
Besma, down to our last minute. Can we do this?
We can. It takes a bit of a culture change too. I think we need to start thinking about buying local, thinking about, what is it that we can, consume based on what we can grow in the earth. Maybe we shouldn't be having oranges in the month of November. Maybe it's just, I think, unrealistic, and we should be thinking about squash and pumpkin. I think there are lots of changes that can be done.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.